just start my short presentation with a question. It's a book, it's HIV/AIDS, it's a book of good clinical practice. Next slide, please. Next slide. Very quickly, like usual, I shall present some summary of the global HIV endemic at the end of 2010. It's very important for everybody to know that at the end of 2010, we counted 30 million of population touched by HIV, and from this, about 70 million women touched by HIV, generally speaking, in the world. Next slide, please. About HIV in women in numbers in 2018, especially in the center part and eastern part of Europe, it's possible to see that in the center part of Europe, especially in Romania, we have we have in this moment about 6,000 in life women who are coming from the beginning of the 1990s. The other counties around has not so many numbers of women in life. Many HIV in women, like in numbers, especially in eastern part of Europe. The slide, please. About HIV testing and care continuum by WHO region in 2010. In WHO region in Europe, and from this point of view, we are counting women from center part of Europe and eastern part of Europe. It's possible to see the number of people living with HIV, and from this, how many are received antiretroviral treatment at the end of 2010, and from this, how many, generally speaking, we counted polyvirus suppressed among all people living with HIV. Next one. Almost 47% of the new cases are women, generally speaking, in the world. And it's important to know that about 5,000 of new infections appear in adults and in children, and from this, up to 47% in women, and especially in young women. Next one, please. Europe. Next one. What is very interesting and in a way new 2017 and 2010, and starting with this, we can count what we count until 1990s until now, and what we are counting is from the point of view in 90s in Europe. At the end of 2010, the majority population touched by HIV appear like young one, especially in eastern part of Europe. Like heterosexual transmission in women, up to 30% in eastern part of Europe, and like CD4 under 300 is very interesting, equal about 74% in center part of Europe, and in 55% in eastern part of Europe. Next one. HIV and women in Europe. From the point of view of rates, if you are looking at this map of Europe, with if you are looking, it's possible to see Western countries with women center, and especially in part of Europe, with the majority of the new cases who appeared in 2018 and who are counted more and more starting with 1990s. Next one, please. Characteristic of women diagnosed with HIV in Europe in 2010. In the center part of Europe, the majority of the women who entered in the national database entered between 25, 29, 30, 39, and also in eastern part of Europe between 25 and 39, but especially between 25 and 29 in their fertile age, is very important in the future, like vertical transmission. From the point of view of the transmission mode in Europe for women, it's possible to see that the majority cases in eastern part appear like interesting, like heterosexual transmission, injected drug use, and from mother to child transmission, the majority of the cases appear also in eastern part of Europe. From the point of view of CD4 again, is a balance between 57% of CD4 under 300, like late presented in center part of Europe, until 57% in eastern part of Europe. The next one. Very interesting method with distribution in women with HIV in center part of Europe and eastern part of Europe between 1992 and 2017, and it's very interesting to see that is the majority of the cases appear now up to 30, 39 and to 50 years old, especially in this part, in the center part and western part of Europe. Next one. Next one.
Slight delay, Mariana. Bear with us.
Okay, not a problem. Okay. Next one. Like HIV transmission route in Europe between 1992 to 2017, it's interesting to see, especially in the for the women by HIV in center part of Europe, like in western part of Europe, the majority of the cases occurred in starting with many, many years ago, like heterosexual transmission. The next one. HIV mother-to-child transmission among the native-born population per 100,000 live births. The majority of the cases is interesting, appear in center part of Europe, especially from the point of view of women by HIV in center part of Europe. And in red is Romania, it's my country, and it's possible to be like an explanation, because between 2010 2013, we had an epidemic in HIV drug users in Romania, in Bulgaria, and in Greece, and the majority cases appear like women discovered women directly in maternities, and because of these new cases like vertical transmission, not many like numbers, new one. The next one. Estimated number of women living with HIV in Europe and in center part of Europe and in eastern part of Europe. About 100,000 women living with HIV, and from this, about 30,000 women living without knowing their diagnosis of HIV. The next one. Next one. Some issues for women with HIV left behind in Central and Eastern Europe and perspective for the future. It's very important to understand in this moment that it's possible to discuss about young by age, old by treatment, especially in Romania, to 3,000 young women between 25, 29, 30, 34 from the so-called Romanian cohort infected in the late 80s. Health issues, neurocognitive disorders. The majority of the cases in center part and especially in Romania appeared many, many years ago. Depression, dyslipidemia, cardiomyopathy, renal disease, and other comorbidities. Barriers in accessing care more from economical constraints, lack of gender autonomy, stigma, and in some countries, lack of resources. Higher risk of HIV transmission in women who inject drugs. More use of new psychoactive substances, especially outbreak in Romania and Greece in 2013, and behavior risk related to male partners, injective drug use, sex with other men, alcohol use, multiple partners from areas with high prevalence. The next one, please. about barriers to HIV care for women in Central and Eastern part of Europe. Is some idea from community stigma, fear to avoid possibility to meet people they knew, some geographical distance. In some countries, also in center part of Europe and eastern part of Europe, lack of personal resources, care responsibility for children and other family members, lack of social support, some problems in educational barriers, lack of psychological support, lack of family planning, and I think that in the future we meet some problems about immigration to Western countries, lots of follow-up. Next one. In 2017, in Milan, it was presented a very, very interesting study with WAVE about models of care for HIV-positive women in Central Europe, and I think that also in 2020 is in the same. And it's very interesting to see from HIV clinics for women, generally speaking, no, until integrated HIV and gynecological care, HIV testing in pregnancy, until some problems, especially for the other one, cervical cancer screening. Next one. Access to a very important problem in central part and eastern part of Europe. The problem of access to treatment for women with substance abuse in Eastern Europe. A very important study, it was deployed, next one, starting with 2012 in center part of Europe and southeastern part of some countries in southeastern part of Europe. And the majority and the countries were involved in this study, it was from Slovenia, Croatia, Czech Republic, Poland, and Romania, and other 4 countries from Israel, South Africa, Malaysia, and Indonesia. Next one. Next one. Next one. No. If you please back a little bit.
This is the last slide, Mariana said that we have. Can you go back one? Let's
No.
go back.
If you can back, no, a little bit back. Little bit back. Back. Okay, back a little bit.
Okay.
Back a little bit. Okay. Okay. Another one. Another one. The next one. Next one.
Next.
Here I remain. Okay. The results from this study very important. It was, generally speaking, it was and it is a very, very important problem. The lack of knowledge about IV drug users, especially in women, and especially in the new type of new stimulant use, especially in central part and eastern part of Europe. Very quickly, next one. Next one. For the point of view in Eastern Europe and Central Asia, it's very important to see the difference between 2015, 2017, like numbers in new cases, numbers, population in life touched by HIV. Next one. And leaving no one behind in HIV response, data from Eastern Europe and Central Asia. The majority of the new cases appear between young one, between 15 and 24, and it's very important, the new type of feminization of the epidemic in this region. Next one. Women and HIV in Russian Federation from St. Petersburg, from a very important meeting in June 2019. Main transmission heterosexual contact, the women touched by HIV in Russia. Deliveries in women to 15,000. HIV women safe pregnancy 70%. And start with antiretroviral before 24 weeks of pregnancy, 79% in 2017. Next one. Which women are left behind and in which context in Central Part of Europe and Eastern Part of Europe? Some very quickly difference between regions, population size difference from the one region to another, high number especially in Eastern Part of Europe, income difference from one region to another one, type of epidemic totally different from Central Part to Eastern Part of Europe from the beginning of the 1990s. Access to treatment is different by region, especially access to the latest molecules. That one, I think, that we might think a little bit, how can tax guidelines be applied in the light of those above, knowing that not all countries have the same access and coverage to the latest treatment. And I didn't discuss about PrEP, not uniform in all European countries. Difference in the age in women across European region, which determine risk behaviors. It has migration lately from Eastern European countries to Western European countries. And from this point of view, very important things about unsafe sex, which is predominant way of transmission in women, especially in Central Part and Eastern Part of Europe, and different standards of services which lead to different standards of care for women touched by HIV. The next one. From linkage to care to linkage to prevention. Prevention comes first. Next one. Last year in January, not in 2020, in 2019, we had a very important meeting about standards of care in Central and Eastern part of Europe, and there it was launched something like this. One, early detection for all population touched by HIV, and in our this meeting, from today's meeting, especially early detection in women. Testing screening campaign, ensure access and best-in-class treatment and universal access and equal, especially from the point of view of treatment. Improve access to treatment, ensure quality, prevent discrimination, revise medical guidelines to be affordable for everybody in Central and Eastern part of Europe. And very important to revise the collaboration between GPs, specialists in JOS, and also include health economical in treatment paradigm. The next one. Reduction in transmission of disease through raising awareness and ensure public recognition of the importance of HIV, Hep B, and Hep C. For example, in Romania, generally speaking, in the population by HIV, in the new one, IV drug users, we have up to 80% touched by HIV, touched by Hep C. Make Hep B, Hep C, and HIV 100% preventable disease with the implementation of the National Prevention Plan. And the next one. And the last one. Women and K population face even more difficulties. The aging phase of HIV. If we are discussing about women with HIV in Central part of Eastern part or Eastern part of Europe, they are coming from the beginning of the 1990s. We are now in 2020, and we must recognize this situation: neurocognitive disorders, cardiomyopathy, lipidemia, renal disease, comorbidities, B, C, and from this point of view, we must have the same language from the point of view of drugs insurance and from the point of view of national and international guidelines. Thank you very much from Bucharest.
Thank you, Mariana.